Greetings. I am Dr. Paulina Van, author of Regala Healing, an evocative approach for self care, self understanding, and inner healing. I have the honor of hosting this show, The Poetry of Healing, and I welcome you from all over the world. And we'd love to know where you're joining us from. So if you put it in the chat, that'd be great. This month of May, I've devoted the segments to those known for caring, nurses and mothers. On May 1st, Dr. Hooper Arana joined us to discuss overcaring. On May 8th, my daughters Angelica and Jasmine joined us to discuss how to enrich mother-daughter relationships. During this month of May, we have celebrated National Nurses Day on May the 6th, National Nurses Week, May 6th through the 12th, and then International Nurses Day on May the 12th, which is Florence Nightingale's birthday, the founder of modern nursing. This segment is about self-care for nurses, focusing work on the front lines in their respective specialties. They will join us later in the program. I ask you to join me and embrace the goals for this session. And I hope to take you and guide you to look behind the scenes at the specific situations and conditions that drain registered nurses and implore them to adopt self-care practices. Also, understand the challenges registered nurses face balancing caring for others and themselves. And then also, we'll explore self-care practices that work. We'll also have a dedicated meditation for nurses. So, as always, we begin with a centering exercise to focus and collect our energy for this time together, a time for you, a gift for yourself. And so, let's take a moment and settle into the space so we can be fully present. And we're going to practice heart math, our heart focused breathing that we typically use to open our session. For those of you who are joining for the first time, I'll just give you a couple of tips about breathing. And we breathe through our nose slowly and out through our mouth. And when we focus our attention on our heart, it may be helpful for you to put your right hand over your left chest in that heart space area. So let's practice, and I invite you to participate. Lower your gaze, close your eyes if it's comfortable for you. And then we're going to connect to our heart by doing heart-focused breathing. So focus your attention in the area of the heart, the left side of your chest. And I'd like you to imagine your breath is flowing in and out of your heart or chest area, breathing a little slower and deeper than usual. So when you take an inhale through your nose, imagine it's your heart breathing and expanding that beautiful heart of yours. And then when you exhale, imagine it just getting smaller and you're exhaling through your mouth. And remember, slow and deep. You might want to count to 5 so you can slow yourself down. So you can breathe in 1, 2, 3, 4, 5, and then out 1, 2, 3, 4, 5. And you can keep your eyes open if you'd like, because you can do this any place, anytime. If you can't hold your breath for 5 counts, do it for 4. And those athletic types, do it for 6. Okay. Take a breath on your own. Okay. And now I'm going to ask you to take a deep breath to notice you are here. Take a deep breath to notice how your body feels. And now take a deep breath to enter the session. For those viewers who have just joined us, I am Dr. Paulina Van, author of Regala Healing, an evocative approach for self care, self understanding, and inner healing. And I'm the host of this show, The Poetry of Healing. We have just completed our centering or mini meditation exercise, and today's topic is self care for nurses. So before we jump into the topic, I want to give you a little background. When you hear self care and nurses used in the same sentence, you may feel there is a disconnect between because nurses are expected to care for others. Self care is not selfish. There should be no guilt about it. The fact that one needs to care for self before caring for others has become a mantra of sorts. This segment is all about the caring given and needed by Black nurses. Before I invite my special guest, I want to build the foundation of self care among African Americans. And let me just take a sip of water. Okay, all right. Black history um, has built, I'm sorry, self care has been built on Black history. Okay. Among our civil rights leaders and activists, anxiety and depression were common due to the hardships of the struggles. Self care was survival and a form of building resilience. Rosa Parks practiced yoga. Angela Davis practiced yoga and mindfulness, especially while imprisoned. Harriet Tubman is synonymous with the Underground Railroad and leading slaves to freedom. Rarely is it discussed that she too was a nurse who cared for Black and white soldiers during the Civil War. Lastly, and more recently, well, not more recently, but lastly, Madam C.J. Walker in the early 1900s developed hair products to promote Black hair as beautiful. She improved her own hair loss challenges and promoted self worth and self care among other Black women by developing products made specifically for their needs. Let's look at nursing in general. Nursing is a rewarding profession. I call it a calling. We as nurses have the privilege of supporting and caring for others during the most vulnerable times in our lives and their lives, be it during birth or end of life transitioning. The reality is, to become a nurse and practicing as a nurse is stressful work. And it's stressful at work, it causes stress at home, and it is just plain stressful. This stress has impact on emotional, mental, physical, and social aspects of nurses' lives. A recent American study reported that since COVID, 54% of nurses have or report a moderate to high level of burnout. Given what we know about nurses of color, especially Black nurses, most likely the burnout rate is much higher among them. Our guests today are two nurses who will pull back the curtains on the intimate personal experiences of nurses and specifically the experiences of Black nurses and the importance of self care. So it is my distinct honor, pleasure, excitement to welcome our two guests this morning, and they are Nafisa Lee and Kim Scott. So I want to welcome both of you.
Good
Good
morning.
morning. Good morning. It's so good to see both of you. And I'll just give the viewers a little bit of your background, then we're going to jump right into um, your perspectives and just excited to hear what you have to say. So we're going to begin with Nafisa Lee. She earned her bachelor's in nursing degree at Dillard University. So those of you out there who are Dillard students or alumni, okay. And she earned her master's in healthcare administration at the University of New Orleans. Did I say it right? New Orleans?
New Orleans, that's right.
New Orleans, okay. And her specialty is perioperative care, or she works in the operating room. Her community efforts are tireless, and she's devoted to educating and advocating for their healthcare needs. So, welcome, Nafisa.
Thank you for having me.
Uh-huh. And Kimberly Kim Scott is a nurse leader in the San Francisco Bay Area with over 20 years of healthcare experience. For years, she has held leadership positions in the Black Nurses Association, both at local and national levels. She recently co-authored a book about racism in nursing. So, Kim, you have provided the foundation. I can't wait to hear what you have to share with us. And so, both these are very special guests, but I guess I always say that, but they are. Everyone I bring is special. And so both are community activists, and we have a special connection. We worship together under the spiritual leadership of Bishop Keith Clark. So I see that Ellis has joined us, and I want to take this opportunity to wish him a belated, Ellis, you went away, wish you a belated happy birthday. So if you want to give Ellis, our director, uh, some belated birthday wishes, please feel free to do that.
Happy
And so,
birthday, Ellis.
Kim and Nafisa, I think we're going to jump right into it because I do want you to talk about what are the specific situations or conditions that drain registered nurses and beg them to adopt self-care practices that are essential for their well-being. And then I'd like you to also speak to specifically what specific conditions drain Black or African American nurses, and for them to, need to adopt self-care practices for their well-being. So I'm going to begin with Nafisa.
Well, good morning again. Thank you for having me, Dr. Van. I appreciate the opportunity to share my perspective. For myself, I love what I do. I love the intricacies of it. I love the constant learning of it. I love the caring of it. I love meeting new people and their personalities and learning their cultures and adapting my nursing style to that. Um, but at times it can be draining when you have 12-hour, 13, 16-hour work days, and then you have to turn it back around and do it the same way all over again. Sometimes the bureaucracy of healthcare can be extremely draining. Although you have a love for treating your patients, sometimes the hurdles that you have to go through to be an advocate for your patients can be a task in and of itself. And so at times, although we are committed to giving health care, it's also a practice. So sometimes you don't have the optimal outcomes that you would hope for that are your goals, and you don't meet them. And so at times that becomes a hurdle that's draining when you want something to happen for somebody and you've done all that you can do for them, and then still to no avail. And then they're still struggling in areas. So that can be a challenge and a hurdle that even though you've given it your all, the next day you got to go back and give it your all and pray that you'll be successful in your next endeavor. I would say, as a Black nurse, what can be challenging for myself as a Black female nurse is fighting through the angry Black female persona at times. That can be draining. That because you are intelligent, you're educated, and you're vocal, and you're passionate and proactive about something, that can be perceived as being angry and possessive and aggressive. That confidence can be misconstrued for aggression, and sometimes that is a hurdle for me. That someone who, excuse me, invests their time in me and asks for me to do something because of my expertise now wants me to quiet my voice and not speak up for my patients. So at times that can be a hurdle. But all in all, through it all, I still wake up with the love to go back again and treat those who need me to treat them.
Mhm. Because as I said in the introduction, for many of us, and I don't want to misrepresent it, but I can't say all because there's never all or nothing. But for many of us and most of us in the profession, we do embrace it as a calling, as
Yes.
opposed to just a job. So thank you, Nafisa. That came from your heart, and I really appreciate that. So Kim, what would you like to add?
Yes, Dr. Van.
Mhm.
Again, thank you for the opportunity as well. And this topic of self-care, we hear a lot about it now, and in the past, we heard nothing about self-care. So I appreciate the opportunity to talk about it.
Mhm.
And over the last couple of years dealing with the pandemic, I think we've gotten back to the basics and the essentials and what really matters. And in the hustle and bustle of life, that gets further and further and further out of reach, right? And even out of our minds. So, being a nurse that I've worked in several different arenas, first in the emergency department many, many moons ago, as a manager, a majority of my 24 years in nursing, and as a consultant, there are different challenges in those respective areas. So, as a frontline nurse, you are with that patient, you are providing direct patient care. And as Nafisa said, dealing with the bureaucracy, dealing with the hierarchical systems and classes in healthcare, dealing with physicians, dealing with your managers and your leaders, you have to navigate that, and at times it gets in the way of you providing your best care. And so there's this constant kind of shoving, just kind of a tug of war at times of keeping your focus on that patient, and knowing that that's your focal point, but also having to deal with all of the internal and external factors that can contribute to that care. The other piece is that, as you said, as a nurse, we feel like we are superheroes, right? That we are going to show up and we're going to save the day, we're going to save our patient, but we have our human factors that are all, we're all human, so we're all fallible. And placing yourself like that is hard sometimes as a caregiver, because you feel like I have everything I need in my tool case to take care of all of the kinks and the and the dysfunctions. And at times we don't, at times we're showing up having turmoil in the home, right? And we've been taught to leave home at home. You can't always leave that at home. If your child is sick, if your child is going through something and you have to show up to work with your smile, right? So those are things that really position nurses to have a lot of conflict and turmoil going on. Then we have now technology. We have the whole healthcare system has changed in the sense of our members are more informed, whether it be they show up and they've read through Google and either they're right or wrong. We've always been told that the customer is always right, but we have to be strong and confident in our knowledge and come against that and make sure that they truly understand. So there's a lot of tangled webs that we have to navigate through as nurses. So if it's in the boardroom or in the classroom, there's going to be those struggles as nurses and the different many hats that we wear. And then as a Black nurse, as Nafisa said as well, you must possess emotional intelligence. And we all at different levels may or may not have that. We have to, one, understand who we are, and for me, whose we are, and where we show up. And that the perceptions of those that you serve may be completely different from the truth of who you are. Being able to kind of circumvent that, like, this is what my audience, these are what my staff, these are what patients, this is what my manager may think of me, but I know who I am, and navigating through that. So I think of an example when I became a manager for the first time, and I took over for a woman who had been there since the beginning of the program, a white older woman who was like motherly. And I said, oh, here I am, this young black bald head girl coming in. And I know I'm the change agent, but I know that I'm going to have some struggles. But Kim, you have to be confident. You have to be strong. You have to be prepared to deal with any situation that comes your way. And then, of course, we deal with the microaggressions. We deal with if we get emotional or if we respond to something that it is aggressive, or I see you're angry, and then how we internalize that. So, okay, here we go. Now I'm aggressive. So we have to deal with a lot. We really do. We have to work harder than our our colleagues that may not look like us, to just have the, kind of a level of respect. And so it's hard, but we're resilient. We're resilient.
Well, thank you so much, because you talked about what is personally, I mean, that impacts your spirit, it impacts your mind, and it can impact your self-worth. And both of you are very strong women, but we have some Black nurses who may not have that strength. And then we have the structural issues where we might not get afforded the training and mentoring that others get. We may not be afforded structurally the policies and procedures to protect inclusion and diversity. So there is a lot, but the bottom line, and we all agree that this is our calling, to care for and support others in their most vulnerable, sensitive times. So we have time for each of you to give one tip that you use as a self-care effective strategy. So, Kim, can you give us one tip that you do?
I do believe in following direction. Can I give like three? They're really short.
No, we don't have. We don't have
No.
time. Three.
One self-care tip for me is prayer. Prayer before you get out of the bed. Focus on for gratitude. Thank you, Lord, for waking me up this morning. Thank you. And starting to manifest a positivity and manifest the strength to deal with whatever challenges are going to come toward me that day. So putting on my whole armor.
Great. And Nafisa?
I totally agree with Kim. That's like premier. But for me, since I work in the operating room, I would share for others, if you could, most of my day is indoors, where I don't know if it's daylight or if it's raining, the sun is shining, is it cloudy? So I would suggest that on your lunch break, if you can, because I know sometimes that can be overcrowded with tasks, but if you can, go outside and enjoy some fresh air.
That's true.
Walk, eat outside, and just take in a different environment. So your mind can kind of break away from the task of the day. And then so you can return rejuvenated.
Wonderful. Those are excellent tips. Now, both of you really resonated with my poem, I Must Live, as it relates to the joys and challenges of being a nurse. And I'm going to read it, and then I'm going to ask you what specifically resonated with you, or if you have a question for me. I must live, and this is on page 31 of the physical book for those of you who have it, and it's on 29 of the ebook. I must live in spite of the guilt. I must live, or else I will wilt. I must live in the midst of the storm. I must live and know I am strong. I must live, it is the gift of the Father. I must live, and not have to barter. I must live to rise above. I must live and be loved. So what was the takeaway from that? I'll tell you, when I wrote it, that evening I got into a disagreement with my husband around surrounding ourselves with more nurturing, positive people. And he's the kind, he tries to save everybody. And so I thought, you know what? This is not a hill I'm gonna, try to die on. So I just changed my mindset, and I said, people are people, and I have to find a different way to respond to people who bring no value to my life. A matter of fact, may take away. And so I realized that poetry was so therapeutic and that my heart was speaking. And so that's the background for my writing it. So I just want to ask each of you, what was it in the poem that kind of resonated with you?
For
Nafisa?
Oh, okay. So this is one of my favorites. So the whole thing, it's kind of hard to choose, but the line that resonates with me the most is I must live, it's a gift of the Father.
Mhm.
So that I must live every day, a brand new day, brand new mercies that He gives us. So it's a gift to me.
Mhm.
Also, it's a gift, so it's unfolding. I don't know. As I unwrap it, it reveals itself to me. So I should enjoy every moment of it as it unfolds.
Mhm.
And then it's a gift because I am a gift to it.
Mhm.
So just like as you said before, that this is our calling, this is our profession. I am a gift to those whom I encounter.
Mhm.
So that's what that means to me.
Okay, well, thank you. And as we wrap up, Kim, is there a line or phrase in the poem that resonates with you?
absolutely. The line, I must live and not have to barter,
Mhm.
resonated with me because it says, like, I don't have to sacrifice my happiness. I don't have to sacrifice my comfort. I don't have to sacrifice my joy for living. And that again, as a nurse and caregivers, we're giving, 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 giving. And we get to a point where you can't give from an empty cup. You've given all that you can. So you can give and you can take care of yourself. You can give and have joy. You can give and have happiness. You can give and have balance. So you don't have to barter for living or
Absolutely.
for your self-care.
Mhm.
You can have both. Actually, when you get that joy, you can give more.
Wow. I wish we had 3 times as much time here because there's so much. We're unpacking so much, and I have to invite you guys back at a later date so we can continue this dialogue. It has been a joy. It's just filled my heart, both personally and professionally, that you joined us this morning and that you really poured out your heart. You made yourself vulnerable, and I am sure that the viewers will really embrace this and be able to add it to the way they care, whether they're nurses or other caregivers, because what you've said applies across the board. So both of you have a great day, and I am going to close out the session with meditation. So please feel free to um, do it backstage. And for today's meditation, I chose a mindful healthcare breathing practice developed by Dr. Mark Burton. He's a developmental pediatrician in New York. He also teaches mindfulness classes and he uses the breath counting practice for stress. So, this is what it's called, breath counting practice for stress. And I'll put a link below the video afterwards. And he uses it with families with children with developmental disorders such as autism and learning disabilities. I chose this meditation because it's of its simplicity and it can be used during times you really feel unsettled. It can bring you back from different places your mind has gone during the day. Your breath is available to you anytime you need it. You can use this meditation several times a day, and hopefully, it will just become an intuitive response when you feel stressed. And so, breath work is the manipulation of your breath rate and depth. So, how fast you breathe and how deep you breathe. And it can help reduce symptoms associated with stress, insomnia, anxiety, depression, and burnout. And it's only going to take a minute. And so, what I'd like to do is just give you some tips before we do a few breaths. The guidance is when you breathe in through your nose and out through your mouth, and then you count. So, you count, breathe in one, breathe in, breathe out one. So, that's how you control the rate. So, when you breathe in through your nose, you mentally say one. When you breathe out, you say one. So I'm just going to ask you, and again, should only take about a minute to do. Find yourself a comfortable posture, sitting or standing, and pick a place you can be still for just a moment, and then lower your gaze or shut your eyes, or you don't have to because you can do this when no one's even knowledgeable about it. So I'd like you to begin to recognize that there's a physical motion in each breath. Tune into that sensation of breathing, not because we're trying to do anything with our breath, but because it is always there. So you can be an anchor for your awareness. Your thoughts will continue, recognize them. It's okay. Come back to your breath each time you're aware of that distraction and back to the breath again. As I mentioned, you can count your breaths. You can count up to 7 breaths. If you lose track of counting, don't worry about it. 15 seems to be a good place. So you breathe out, breathe in one, breathe out one. Breathe in 2, breathe out 2. Breathe in 3, breathe out 3. And so you just do that to 7 and start again with 1, or you can do it with 15, and that's all you need. So, for a few moments of practice, there's nothing to do and nothing to fix. It's just letting go of a sense of striving or taking or trying to make yourself feel different. Just breathing in or out. So, I just want to thank you for joining us today. Um, I, I read from my book, and it is available on Amazon. The ebook is available on Amazon. The physical book is available on regalahealing.com. And we'll share a QR code with you so that you can just scan it and get to my website. And there are video resources there as well. And I ask that you please join me every first and third Sunday at 9 a.m. Pacific time, right here on blackdoctor.org. Like and share this program. Leave comments because I do read and respond to them. Visit my website and you have the QR code there. And as always, I wish you love and light as you go into this new week. And just thank you for being with us this morning.